what advances in technology over the past 10 years have allowed you to create that natural look with all your patients?
Well, I think there have been a lot of changes in what we perceive to be a good aesthetic result. I think there's been a lot more focus on multiple areas, so not just tightening skin, but also looking at really what's kind of considered the third dimension. I think wrinkles people are very aware of, sagging people are very aware of, but there's been more recognition for volume loss in the face, and that looking natural very often may be repositioning tissue that's fallen. It may also be restoring volume that's lost. I think the other thing that's really come about in the past several years has really been the technology advances. When I went through my fellowship training, if someone came in and were concerned about sagging, loose skin, things of that nature, they were either ready for a facelift or they were too young, come back and see me in 5 years. There wasn't a lot to do in between. But technology's really changed that, because we have methods of skin tightening now that are non-surgical, methods of tightening the deeper tissues and getting some lifting of the neck without surgery. So there's a lot that can be done early on to help maintain the look before you need to think about something surgical. And I think that's an important point, because I think a lot of times people feel like if they're going to see a surgeon, you're going to be sold a surgery. I like to think of it, particularly with my vision for Atlanta Face and Body, having the whole spectrum available, that as a surgeon, I've got the entire toolbox, non-surgical to minimally invasive to surgical. And so if you come and see me, you're not going to get offered only a non-surgical procedure because I don't do surgery. You're not going to get offered only a surgical procedure because I have the whole toolbox available. So we're going to look through that toolbox, we're going to talk about the options, and we're going to find the tool that is going to be the best fit for you to get the results that that person wants.
In the next 10 years, where do you see the advancement in technology going to give you more tools to go in the toolbox?
I think we'll continue to see the different types of energy deliveries get better and better in terms of the potential tightening effects and rejuvenating effects that we can get from them. I think we'll continue to see advances in the injectables. When I went through my fellowship training, the only thing available was bovine collagen, and it lasted about 3 months. Now we have injectables that can last up to 2 years. So the technology continues to advance, the options available for people continue to advance, and I think that's wonderful. I think it's confusing because there are so many different things out there. There's always something new popping up on TV, and that's one of the really things I like about having somebody come in, consulting with them, is really trying to figure out what their concerns are, what's best for them. A lot of times people come in, they've seen something on TV, and that's what they're asking about. And when we really talk about it, that's maybe not the best fit for them. And then we work to customize something that is going to address their concerns, not just reflexively do a particular procedure, a particular injectable.